Hi everyone, welcome back to the channel. Today's video is something all of us can relate to. Whether you live in a small town or a big city, you've definitely seen these medicines at home, in a shop or at a clinic. We're talking about 5 of the most commonly used medicines, the ones almost every family keeps in their drawer. The problem is, most people know the name of the medicine, but they don't actually understand what it does, how it works, or why it's used. So in this video, I'll explain these medicines in a simple and friendly way. No medical advice, just everyday knowledge that everyone should have. Let's get started. The first medicine on our list is paracetamol, one of the most widely used fever medicines in the world. If you open any home first aid box, you'll almost always find it. People use it for fever, flu, body pain, and sometimes after mild infections. But what exactly is paracetamol doing inside your body? Let's break it down. When your body gets an infection, your brain receives signals that something harmful has entered the system. In response, the brain increases your body temperature to help fight off the infection. This higher temperature is what we call fever. Paracetamol works by acting on the center in your brain that controls temperature. It slowly brings that temperature down to normal, which gives you relief. What makes paracetamol popular is that it's gentle, predictable, and usually works within 30 to 45 minutes. That's why doctors commonly recommend it for a wide range of symptoms. But remember, fever is not always the enemy. Fever can be a natural defense system. People often panic when they see the thermometer go above 100 degrees Fahrenheit. But what really matters is how the person is feeling overall. Paracetamol simply helps make the fever more manageable, and that's why it's considered a household essential. Next on the list is Combiflam, which many people use for joint pain, muscle pain, or body aches. Combiflam contains 2 ingredients working together, paracetamol and ibuprofen. Paracetamol brings down fever and reduces pain, while ibuprofen reduces inflammation. And inflammation is something people often misunderstand. Think of inflammation as your body's natural emergency team. Whenever there's an injury or strain, your body sends extra blood, extra cells, and extra signals to that area. This causes swelling, pain, and stiffness, the typical signs of inflammation. Combiflam helps reduce this response so the swelling comes down and the pain becomes easier to handle. This makes it one of the most popular choices for joint pain, muscle cramps, shoulder pain, back pain, sports injuries, body aches from cold or fever. Since it tackles pain and inflammation together, people often feel faster relief compared to taking paracetamol alone. But again, this video is only for awareness, not advice. Medicines should always be taken responsibly. Moving on to medicine number 3, Disprin, a name almost everyone has heard. Disprin is most commonly used for headaches, but people also take it for body pain or fever. It contains an ingredient called aspirin, which has a unique way of working. Your body produces a chemical that sends pain signals to the brain. Disprin helps reduce the production of this chemical, which lowers the intensity of pain. That's why for many people, a single tablet can calm a headache fairly quickly. Headaches usually happen because of stress, dehydration, lack of sleep, eye strain, cold or flu, high screen time, sinus issues. Most people don't realize how much lifestyle plays a role in headaches. For example, not drinking enough water is one of the fastest ways to trigger a headache. While Disprin can give relief, it's not a solution to the cause. It's more like a short-term helper. So if someone gets frequent headaches, they should look at what's triggering them. Aside from headaches, Disprin is sometimes used for body pain too. But the reason it became famous is because of how quickly it works for simple everyday headaches. Next on our list is Cetrizine, a very popular anti-allergic tablet. Allergies can show up in many forms. Some people sneeze non-stop during weather changes, others get itchy skin, watery eyes or rashes, some people can't tolerate dust, perfumes or pollen. Cetrizine works by blocking the chemical your body releases during an allergic reaction. Think of it like pressing a pause button on your allergy symptoms. Here's what it helps with: sneezing, runny nose, watery or itchy eyes, skin rashes, mild allergic reactions, dust allergy, seasonal allergy. The interesting part is that people react differently to allergies based on where they live. For example, someone living near a farm may react to pollen, but someone in the city may react to dust or pollution. Cetrizine is known for being effective, and for most people it starts working within an hour. One reason it's widely used is because it only needs to be taken once a day in most cases. But remember, even though it's common, allergy triggers vary from person to person. What causes an allergy for you might be completely harmless for someone else. And finally, at number 5, we have Lomofen, used during loose motion or diarrhea. Loose motion usually happens when the digestive system is irritated. It could be due to contaminated food, viral infection, bacterial infection, spicy food, or even stress. Many people panic during loose motion, but the truth is, it's sometimes the body's way of throwing out something harmful. Lomofen helps slow down this process. It reduces the movement inside the intestines so the body can absorb more water and stools become less watery. This helps the person feel less weak and reduces the frequency of loose motion. But one thing most people don't know is that hydration matters more than anything else. When someone has diarrhea, the biggest risk is loss of water and salts. That's why doctors often suggest ORS or other fluids. Lomofen is commonly used in many households because it gives quick relief and helps stabilize the stomach. It doesn't treat the cause, but it helps control the symptoms so the person can recover comfortably. So, these were the 5 most commonly used medicines and their everyday uses. Paracetamol, fever; Combiflam, joint pain; Disprin, headache; Cetrizine, allergy; Lomofen, loose motion. These medicines are found in almost every home, and knowing what they do can help you understand your body better. But remember, this video is for educational understanding only. Always follow proper medical advice for health decisions. If you enjoyed this simple breakdown and want more videos like this, make sure you subscribe and hit the like button. Thanks for watching, and I'll see you in the next video.